Let's talk about kidney 7, Fuliu returning current at Jing-River point. Located 2 Chun proximal to kidney 3 at the anterior border of the Achilles tendon. How to find kidney 7? First, locate kidney 3 on the level of the highest prominence of the medial malleolus in the depression between the malleolus and the Achilles tendon. From kidney 3, measure 2 Chun in a proximal direction towards the knee joint and locate kidney 7 in a depression at the anterior border of the Achilles tendon. Located on the same level but more medially is kidney 8. 2 Chun directly proximal to the medial malleolus. Needling vertically 0.5 to 1 Chun. Actions, indications, regulates water passages and treats edema, strengthens the kidneys, especially kidney yang, drains dampness and clears damp heat. For disorders of the intestines due to damp heat, strengthens lumbar region. Special features, Jing-River point, metal point, tonification point. Kidney 7 tonifies the kidneys in a similar way to kidney 3, the only difference being that kidney 7 is better to tonify kidney yang. Kidney 7 is an important point to resolve dampness in the lower burner, causing urinary or intestinal symptoms, and to eliminate edema in the legs. It can either promote or stop sweating. It is frequently used in combination with Li4 to cause sweating in attacks of exterior wind cold, and with heart 6 to stop sweating from kidney yin deficiency. To promote sweating, kidney 7 is reduced, while to stop sweating, it is reinforced. There is an ongoing debate as to whether kidney 7 tonifies kidney yang or kidney yin. Some argue the former, some the latter. It is better to tonify kidney yang. Its indications in eliminating edema would seem to support that as one needs to tonify yang to eliminate edema, a yin pathogenic factor. When using kidney 7 to tonify kidney yang, use moxa on the needle to strengthen its yang tonifying action. However, that does not mean that kidney 7 would aggravate a kidney yin deficiency. Indeed, among its classical indications, there is dry tongue and parched mouth. Acupuncture works differently than herbal medicine, and nearly every point can be used to tonify yang or yin depending on whether one uses moxa or not. REN4 is also a very good example of this, as it is an excellent yin tonic point. But with direct moxa cones, it can tonify kidney yang. Kidney 7 tonifies the kidneys, so good for backache, dizziness, tinnitus, weak knees, tiredness. Resolves dampness for diarrhea, abdominal fullness, mucus and blood in the stools, borborygmi, feeling of heaviness in the rectum. Opens the water passages of the lower burner and resolves edema. So for edema, difficult urination, retention of urine, painful urination, turbid urine, blood in the urine. Strengthens lower back, so good for backache, ache in the knees, cold knees. Regulates sweating, as in sweating and night sweating. According to the classic of difficulties, in cases of deficiency, reinforce the mother. In cases of excess, reduce the child. Kidney 7, the metal and hence mother point of the kidney water channel, is one of the foremost points to strengthen the kidney function of dominating body fluids and regulating urination and control sweating. Both the kidney primary and divergent channels ascend to the root of the tongue, and the spiritual pivot states that the Jing-River point should be needled for changes manifesting in the patient's voice. Kidney 7, the Jing-River point of the kidney channel, is indicated for dry tongue and parched mouth, dry tongue with stomach heat, curled tongue with inability to speak, propensity to anger with incessant talking, and propensity to laughter. As a tonification point, kidney 7 supplements kidney qi, reestablishing the mother-child relationship along the Shang cycle and making this a nourishing point for the kidney. The metal element in its most positive state imparts vitality and abundance. Water is infused and animated by metal through inspiration. As a metal point, referred to in its alternative name deep-lying white, it enriches and imparts quality. This point might be selected when there is over-rigidity in water, or conversely, a lack of structure, so the goal of the qi or will is never achieved. In this way, it can strengthen the Zhi and support the person in overcoming fear and obstacles in their path. Metal point, tonification point, Jing-River antique late summer point used in the husband-wife treatment protocol, endocrine point. This point strengthens and invigorates kidney meridian, bringing energy from the mother to the child. As the metal point, it imparts quality and structure to this official, thus regulating the water passages. Returning current regulates the body's rhythms, for example, sleep, urination, or perspiration. Consider for foot weakness and paralysis, especially in children. You get no movement if the current is not returning. Also for male infertility, example, low sperm count, helpful for night sweats, together with heart 6.